Hello, this is Dr. Rajni Mandal with Pathology Watch, here with your 3D 3-minute digital dermatopathology digest. Today's topic is proliferating pilar cyst. Proliferating pilar cysts are most commonly seen in adult women in the scalp. Most cases arise from a pre-existing pilar cyst due to an unknown trigger. Here you can see a proliferating pilar cyst, and you can see that the epithelium proliferates within the center of the cyst, forming a rolls and scrolls appearance. The proliferating cells are tricholemmal cells, and you can see here that these cells have small nuclei with smooth nuclear contours, a very uniform chromatin pattern, and show abrupt keratinization without formation of a granular layer. The keratin here is very dense, compact, pink keratin. This is in contrast to this case. You can see here at low power, this also has a rolls and scrolls appearance of a proliferating pilar cyst. However, when you go to higher power and higher magnification, you can see here that there is cell crowding and that there's also cellular atypia characterized by difference in size and shape of the nuclei. In addition, you can see mitotic activity. This is a tricholemmal carcinoma, also known as a malignant proliferating pilar cyst. These cysts show mitotic activity, infiltrative growth, and cytologic atypia. Here are your 5 flashbacks for today for proliferating pilar cyst. It's most commonly seen in adult women in the scalp. Most cases arise from pre-existing pilar cysts due to an unknown trigger. The cyst lining has no granular layer with abrupt dense keratin formation. Cyst epithelium proliferates within the cyst with a rolls and scrolls appearance. And tricholemmal carcinoma, also known as malignant proliferating pilar cyst, shows mitotic activity and infiltrative growth and cytological atypia. Here's your review question for today. A 60-year-old female presents with a nodule on her scalp, which has recently grown in size. The nodule is 10 centimeters in diameter and ulcerated. What histological features would support a diagnosis of a pilar neoplasm? A. Cyst lining with matrical cells and keratin with ghost cells. B. Cyst lining lacking a granular layer with abrupt keratinization. C. Cyst lining lacking a granular layer with red roof cuticle. Or D. Cyst lining with granular layer and basket weave keratin. The answer is B. Cyst lining lacking a granular layer with abrupt keratinization, which is seen in pilar neoplasms, such as proliferating pilar neoplasms, pilar cysts, and tricholemmal carcinoma. A is cyst lining with matrical cells and keratin with ghost cells and seen in pilomatricomas. C, cyst lining lacking a granular layer with red roof cuticle are seen in steatocystomas. And D, cyst lining with granular layer with basket weave keratin are seen in epidermoid or epidermal inclusion cysts. That's it for me for today. This is Dr. Rajni Mandal with Pathology Watch, revolutionizing pathology for dermatologists. Check us out at pathologywatch.com.